Tianchi. So where is it located? The point is located on the fourth intercostal space, one tune lateral to the nipple, one tune lateral to the mammillary line. Nipple from here is one tune lateral. So there are the numerous points are located very closer to the Tianchi point. The beauty of the Tianchi, the pericardium one point is the good point in order to understand about the move front alarm point for the pericardium, right? So no doubt the Shenzhang, that is the REN 17, also is the point called as a move front alarm point for the pericardium. At the same time we understand the pericardium one also to be considered as a move front alarm point for the pericardium. So therefore you just look at that, the nipple is one tune lateral to the point is P1. You understand the point is located on the chest muscles. The point is located even for the male also. Try to make it the proper position for the female and then try to find out on the fourth intercostal space that point is located. But this point is the communicating point to the three meridians, those meridians called as a liver meridian, gallbladder and also triple warmer. There are the three meridians communicating point called as a Tianchi, right? The point is in fact located on the chest. You understand all the chest related disorders can be treatable by activating this point. For instance, the people who are suffering for the chest pain or the cardiac pain or the muscular pain or the pectoralis major, the point is located on the pectoralis major muscles and this point is activated that particular condition, which includes the cardiac system functions as well, right? So at the same time when the female is suffering for the pain, which we call as sometimes is the Biret's disease or the Biret score system, we wanted to know. There is the, after doing the mammography or the scanning of the breast, when we look at the Biret's, what is that Biret's? Is the breast imaging, right? Radio reporting data analytic system. That score is, we need to understand whether there is the problem is the lumps or cysts are there inside. If it is there are the scores 1 to 5. If there is a score 1 is there is nothing much significant. There is a Biret's grade 2 that have some kind of the lump within that. So there are the Biret's 3, 4, 5 need to be done like a biopsy or aspiration to be done in order to send to the report laboratory to find out anything there is a growth is there or any benign or the malignant to understand about the cyst. Even that condition, the Biret's 1, 2 condition is there, even 3, third condition also can be treatable by activating this point. And moreover, if you wanted to treat for the chest disorders, please include the other points as well, which includes the, after the Tianchi, there is a 2 tune lateral to the midline, that point to be called as a Bulang, that is Shenfeng. Shenfeng is nothing but is the kidney 23. That point also good point to treat for the cardiac system and also for the chest related diseases. When we look at that again, the 4 tune lateral, so spleen 18, that point to be called as a Tianxi, right? When we look at the point in the central line, which we call as a Shenzhang, so this point is to be called as a, that is REN 17 is a good point to treat for the pericardium, at the same time for the influential point for the pulmonary system also. Lungs related diseases can be treatable. So this point where you can understand 1, 2, 3, 4, 5, 6. When you understand about the gallbladder 22 and gallbladder 23, there is a Zhejian point also located vertically below the axillary crease. You just come down, you can find this area, the point is gallbladder 22, and then 1 tune anterior to gallbladder 22 is the gallbladder 23. All these points are located on the, in the same line on the 4th intercostal space in generally, right? So therefore anything related to this one particular breast is affected, then you understand that one area to be activated, bilaterally having the issues, then combined together can be treatable, activating to the chest related disorders. When you wanted to add up that the few more points which we call as the stomach 17 is the root chung, that point is contraindicated since that point is located directly on the nipple, but superior to that there is a stomach 16 point is located. Then another point we call as a region, there is the stomach 18 point is located, one chun distal to the stomach 17, that means is the all the breast related diseases, it has been covered. There is a lactation deficiency with the mothers could not able to feed the child. Even in order to improve the lactation in the breast, these points also activated. At the same time, when the person is suffering for the related to the, you understand about the anything cancer related conditions, at the same time the people who are suffering for the especially the hypochondriac region pain or the herpes pain, so that condition also treatable by activating this point. Right, you just add up, it's one point is not enough, certainly you can add up the few points, so which having the liberty to use that in order to regulate the whole chest system because of the Dhyan C. So this point, Dhyan is nothing but is the heaven. So anything related to the breast related conditions, certainly you can add up the superior and inferior and then medial and lateral point to treat for this condition. But however you wanted to treat for the milk ejection condition where the milk is not producing enough, add up one point to be called as a Shauza, so that point is the small intestine 1. So including that point and add up this point together in order to bring down the maximum nourishing to the milk, which we call as the oxytocin secretion to be taken place, that to be regulated by activating this point. However, you understand so many points has been incorporated here. When you wanted to treat the only one point, then focus that only one point you can activate, and then if you wanted to use for the some other point because of there is another meridian also affected, then add up that particular respective meridian also. Right, at the same time when you wanted to use as a cosmetic purpose, and certainly you can use this point for the underdeveloped breast and overdeveloped breast or the anything related to the breast. Even in China, the most of the practitioners they utilize this for the females, and even for the male having the excessive breast development, even that condition also to regulate the hormonal changes, that also can be used by activating this point. Then we look at the second point which we call as the Dhyan Chuan. So that point is located 2 chun inferior to the anterior axillary crease on the brachialis muscles. So now the hand having the totally, in generally there are the 4 muscles you can see here. So these muscles which we call as a biceps muscles. So biceps muscles, this is the coracobrachialis muscles is the here. At the same time these muscles are the we call as a brachialis muscles. These muscles are the biceps brachii muscles, and then the this the agonist muscles which we antagonist muscles which we call as a these muscles called as a triceps muscles. So these muscles in generally the points are located on the biceps brachii muscles is the pericardium too. So this point generally is not much recommended, but however you wanted to treat for anything the shoulder related disorders, especially the problem is affected on the distal to the acromion process where there is the inferior margin. So where the anterior deltoid muscles are affected, then you understand you need to focus and treat by activating this particular point. So this point really good to treat when the shoulder related conditions also can be treatable. At the same time when you wanted to treat for the anterior deltoid muscles, you add up the another point which point called as a Yunmen point, that is lung 2 point as well. Right, both our points are good to treat for the anterior shoulder pain is there. If there is the middle deltoid muscles is affected, then that the point to be activated, the Binot point, that point is a large intestine 14. When the point is on the posterior deltoid muscles are affected, then you understand focus the Qianzheng point, that point to be called as a small intestine 9 point. So therefore now you understand the pericardium 2 is generally can be treatable by activating this for the shoulder brachial syndrome conditions. Now we look at the most crucial point. Now the coming points are really great important point. So this pericardium 3 point is called as a QUZE, Q-U-Z-E. So this point to be located on the cubital crease. So you just try to find out the location. So now this the point called as a QUZE. When we look at the location, this is the exactly, so these muscles you can find the biceps muscles, biceps, bi means is the two muscles, this comes on the downwards direction and then meeting to both the muscles will come downwards direction and then finally that will become one tendon, that tendon to be called as a bicep tendon. Right. So when you semi-flex, you just semi-flex the hand, you can find this is the elbow. In that, try to touch and feel that tendon. So tendon, the lateral side, the point to be called as a CHIZA. On the medial side, the point to be called as a CHUZA. CHIZA, that is LU5, and CHUZA, that point is called as a pericardium 3. So but how to find out and how we should apply this point? So when try to see and palpate the point before inserting the needle, that in fact is very crucial. So now just wipe the entire area and then try to see the palpate to the brachial artery. The point is located in fact very closer to the brachial artery, but you should not enter the needle to the brachial artery directly, in fact that you are damaging. So therefore you understand that point is located beside of the brachial artery. So I touch and feel, palpate. Once I palpate that where is that brachial artery, now I am finding that brachial artery, so I should not insert the needle. Beside of that I need to just insert the needle is pericardium 3. It is the tonification point, that means it's ascending direction of the energy. That means where the energy starts from the chest, it descends the downwards direction and then passing towards the middle finger. So therefore this point to be called as a grandmother point, and this point to be called as a tonification point, and this point to be called as a conjunctory point and Hasi point. So therefore anything related to the brain activity is the very poor. Even the people who have the autistic child, or the people who have the related to the Down syndrome conditions, and also the CP child patients, even that condition also can be treatable by activating this point. So this point is to be treatable by activating the tonification or sedation both. But however, when you wanted to tonify where the brain function is partially weaker than the normal, where the cognitive functions and behaviors are very weak, at the same time thinking capacity is not good. So you understand the people who are suffering for the schizophrenia, mania, all the psychosomatic diseases can be treatable by activating this point. But in fact this point is the very good point to treat for all the gonads related diseases, and this point is corresponding and water point of the pericardium, that indicates that this point is communicating from the kidney to the pericardium. Then you understand the gonads for the male gonads is the testis related diseases, or the female ovaries related diseases can be treatable by activating this particular point. So therefore you understand when the person is not at all getting fever, you understand when the patient is getting the migraine very oftenly, that means is every frequently they will get the pain. So either temporal headache or the parietal headache or the which we call as a frontal headache, anything related to the headache very oftenly for the span of several years the person is suffering. So then you just ask them, so they say, sir, I don't have the fever, but means I don't get the fever at all for the last several years, even I never experienced this fever. So that is, there is the problem which causing the headache also, you understand. So fever also required every month, slightly the heat is flaring up to the body in order to nourishing the entire cells in our body, which also essential. So even that particular time, how to be managed? So without taking medication, certainly you need to manage without taking paracetamol also, without taking any acetaminophen, without taking any antibiotics. In fact, the giving the alarm to your body that your cells are very coldness, so excessive causing the problem is with weakness and lethargy, and the muscles get contraction, which leads to headache, which leads to the fatigueness and lethargy and giddiness and numbness. Even these conditions, when this point to be activated, you understand slightly the heat flares up internally sometimes, which is essential to our body also. Most of the times I noticed that if I strongly manipulate this point, but in fact strongly manipulating also initially you people are not recommended, since this point is deeply touching to the medial nerve, at the same time this point is touching to the brachial nerve also. So therefore you should not insert the very deeper level, surface level you wanted to treat. Initially you just try to focus to treat by activating this point for the numerous diseases. Certainly this point will be useful, including the infertility conditions as well. So most of the, I told you, anything the ovaries related diseases are not the fallopian tubes related conditions. In generally this point good to treat for related to the gonads, because of the infertility is the numerous reasons to cause the problem. The fallopian tube also is the reason, another cervix also is the reason. But however this point to be activated only related to the ovarian syndrome is there, or ovarian diseases is there, even that condition this point to be activated to regulate the endocrine system. At the same time there is the hormonal system in our body as well. So this point is male also can be treatable, at the same time female problem also can be treatable by activating this point. So therefore the one of the among the master point in our body, I can say that point to be called as a pericardium 3 is the choosa. Known and unknown cause of the diseases can be treatable by activating this point. In fact this point is the life reviving point, life resuscitation point, because of you understand when the person is the maximum level at the age of 70 years, 80 years and 90 years, the right point to select is pericardium 3, because of they are very lethargy always, which was I told you the cycle of the person, cycle of the men and women. So 7 years and 8 years cycle. So once it's completed 70 years, the maximum energy is completed on that particular time. Down the line what is required is the maximum fire energy is required to them in order to regulate and speak and work abundantly. There is no fire within them, which leads to the several diseases. The coldness is excessiveness, which leads to the cancer conditions. When the fire is excessiveness, of course that causes the hypertension, insomnia, no doubt on that. But at the same time those people are dependent of the conditions, so which is required for the activation and tonification to them. So anything about the 70, 80 years, 90 years, you understand, to revive their life, that to be activated, the point I can say that point is pericardium 3. So powerful point. So you can activate this point. Even the people who oftenly go for the urination, the nocturnal enuresis, premature ejaculation are related to the in the diabetes nephropathy, diabetes related conditions where they go for the polyuria, excessive urination at the night times. Even that conditions also can be treatable. This point is located on the brachialis tendon, closer to that on the elbow crease. Then you understand this point is treatable for the elbow related diseases. At the same time is the elbow arthritis. This point to be activated for the golfer's elbow. If the Chiesa point and L11 point treatable for the tennis elbow, but this point to be treatable for especially for the shoulder related, that means shoulder as well as is the elbow related diseases. When the person is getting for the elbow pain, then you understand one or other way the cardiac system also included. The heart is the reason to cause the elbow pain. The heart is the reason to cause the wrist pain. So therefore the pericardium also governing to the protecting to the heart system. So therefore the pericardium 3 Also good point to treat for the elbow and then wrist related diseases. At the same time, this point is activating to the medial nerve where the flexor muscles are not functioning. In that condition, certainly you can use this point. At the same time, the motor points are existing on the same line. 2 chun, 1 chun distal to the pericardium 3. There is another motor point. There is one more motor point is located again 1 chun distal to the another point, which we called as a this point is this one point called as this the motor point for the medial nerve. At the same time, this point also called as a medial nerve motor point. There is no acupuncture points here located. You press and feel where the patient feel kind of the tenderness. Even that conditions you can treat by activating this point. Even the hemiplegia conditions and paralysis patients where the flexor muscles is could not able to lift the hand, could not able to open the hand in the properly. Even that condition, rather than treating for the extensors, better you treat for the flexor muscles by activating this point. However, after adding this point, you just add up the motor points of these muscles, so that always is good for the flexor muscles treatment, right? So when we look at the pericardium 4 point, so that point to be called as a semen, called as a this tendon called as a flexor carpi radialis tendon. So this tendon called as a palmaris longus tendon. There is a one more tendon called as a flexor carpi ulnaris tendon. So this tendon, there is a one more tendon which we called as a here. So flexor carpi radialis tendon, flexor carpi radialis, and one more tendon is the extensor tendon here. So now you can understand, when you wanted to know about this particular point, where this point is located, then try to fold that. Try to close your fist strongly, then you can find the tendon. You just try to see, now you can find the tendon, right? 2 tendons. So in between these 2 tendon, that point to be called as a pericardium 4. So pericardium 4 is the C cleft point, or we call as the accumulation point of the pericardium. When there is the condition of the neurasthenia, is the mental and physical related diseases, even the person could not able to focus and concentrate, which includes the cognitive functions, all are related to the pericardium. When we apply to that pericardium 4 point, you understand that point also lies on the closer to the medial nerve. So you are opening up to that channel in order to regulate properly, in order to open up the channels properly. So once it open the pericardium channel, which communicating to the cardiac system, from the cardiac system is communicating to the central nervous system, right? So therefore the pericardium 4 is only the C cleft point, which is crucial point to treat for any kind of the acute conditions of the brain function, at the same time for emergencies, right?